I said I also just cooked up, so I have this nice breakfast burrito that I just made. I'm gonna be eating that.
Perfect.
That's John's breakfast burrito.
Chefing up.
The hell.
All right, we're gonna go ahead and start. Hello, everyone. Welcome to another Black Kids White Coat Teachers video. Coming at y'all on this early Saturday morning with another gem of a vid with these amazing, almost completed interns, right? Everyone's almost done with their intern year. And they're all an amazing program going into emergency medicine. So I'm just going to introduce myself first. I'm Nelson, for y'all who don't know. I'm going into radiology, but first doing an intern year in Milwaukee. Who else do we have?
Oh, I'm Lily, and I'm a fourth-year medical student.
I'm Adama. I'm finishing my intern year, and I start my second year tomorrow. And I'm located in Los Angeles.
All right, we'll go ahead and go in alphabetical order. Carlos, go ahead, just tell us a little bit about yourself and as little as you want.
Oh, yeah, I'm Carlos Michael. Just finishing up intern year in emergency in Chicago. Originally from California, Sacramento area.
Okay.
Well, UCSF.
Yeah, Cali in the house. All right, what's up, John?
All right, I am John Eloue, Chicago born and bred, Nigerian American.
Hi, Jack. Yes.
Yes, now. I'm in the emergency medicine program in Chicago, finishing up my intern year, a few more shifts.
Yoni.
No, what up, y'all? I'm Jonathan Devisai. People call me Yoni. Born and raised in Toronto, did med school in New York at Mount Sinai, and then moved to Chicago for EM. I'm also an intern. Got 3 more shifts left, so Carlos beats me by 2 shifts, 1 shift, because it'll be done before me become a second year. But I'm also with John as well at the same program.
Dope. From the 6. Did you ever meet Drake?
Nah, but I saw him outside the shop like 10 years ago.
Oh, snap.
How many times did you hear that?
Every time. And actually, it's the same story every time. Yeah, I just saw him outside the shop 10 years ago.
Low key though, y'all got some good maple syrup.
That's another one we hear a lot.
No, I'm not saying that. My friend brought me back maple syrup.
Yeah.
Fire.
That real stuff, you know.
And those ketchup
Aunt Jemima's over here.
Those ketchup chips, fire, flames.
Hilarious.
Yeah. Oh yeah. So thank y'all again for joining us. This is going to be a very informative episode, especially for me, seeing as I'm entering my intern year. I'm literally going through orientation right now, half virtual, half in person. So I'm going to be taking notes during this for sure. So just a general question first. Kind of tell us how, what program you're in, emergency, right? How is that different from, that intern year different from other intern years? And anybody can go ahead and start.
I think one of the things that kind of differ when you do emergency year and especially intern year is you get July off. Most programs have that month of July off in terms of it's like a whole orientation month, which goes a long way, first of all, in order you to get comfortable with your co-interns. So you do a lot of outings together. There's a lot of sessions they have for you during the day, orientation, where you can do things from like they have like different procedure days to different Orview courses. And then you also get some, in our institution, they call them princess shifts that get sprinkled in that month. So you do like 5 princess shifts where you're like extra staff and just for you to get like familiarize yourself with the ED and like the EMR. So that goes a long way. Because after that month you get really close with your co-interns and you also sort of you don't get like thrown right away into the deep end and start drowning, so it's kind of nice.
Yeah, I think it's important. I think one way the emergency intern year is different from other specialties is we are doing a lot of like off service rotations, and you'll go, especially now with like COVID, you'll go weeks, sometimes months without seeing your co-interns. And so it's nice to like build that relationship with them in the beginning because you don't have much opportunity like once you are busy on rotations and, you're sometimes feeling like an outsider or a visitor on services because, because the rest of the teams, rest of the residents are like medicine residents or surgery residents. And you get to know them and you get to know people around the hospital, but you don't get to kind of be with like your family like as much as other programs.
I'd also add on that, the breadth of what you're seeing as an emergency medicine intern will, of course, vary across the country. But given that we're in a major city, very urban area, we see a lot of really incredible stuff. And so although we're, rotating on off-service rotations, and we are back in the department, we're able to apply those skills, use those skills to see the breadth of what we see, as opposed to kind of seeing only maybe women's health or adolescent health or kind of image-based medicine, things like that. And so it's kind of a really big breadth of what you can see. And then you find that throughout the intern year, you get a little more comfortable with everything while still being uncomfortable with the things you haven't seen. So it's kind of like a push and pull constantly.
Okay, excellent. So thank y'all for those responses. So just think back, to over a year ago, a little under a year ago, when you were in my shoes, going into intern year, maybe being a little nervous, being a little anxious about what to expect. How has intern year kind of been to you all? How have those expectations been versus what you've seen in intern year? Anybody can go ahead.
And I love an intern year. It's been very fun. And I use the perspective of my wife. She's also an intern in ENT. And so our intern years have been very, very different. Our hours have been very, very different. So I constantly feel blessed. Everybody goes into their specialty for a certain reason. So I do love that we have more time to explore things in and outside of medicine, given that we're on a shift-based schedule when we're in the department. I love that, we can see a lot of different things and just find what we enjoy. And so I've really been digging that. The camaraderie in emergency medicine is amazing. And that just goes into picking a program that you feel like you're part of. So that's been amazing. From our second years, third, fourth years, our seniors really guide us. They get us in early on kind of more complex things. And it could just be in the middle of a shift. They'll pull you aside and say, hey, this is something I want to teach you. And you find out maybe the next shift or a shift, who knows when is, that's something you're going to be using. So I'd say it's just a really team-based environment, and intern year has been really fun. Now, there have been challenges, of course, and with these off-service rotations, some of them have been really, really difficult. You find that you're alone. And we'll probably get into it later. There was a time where I was alone, critical crashing patient on burn ICU, couldn't reach the fellow. And I'm just like, oh my God, like, I don't know what to do. All my medical school knowledge is flashing in front of my eyes. And I'm like, I don't know. And I'm like, I'm just gonna wait. I'm gonna call the emergency medicine senior who's always on trauma. We always have a senior on trauma. And they're like, if anything goes wrong, you can always call us. So I call them, run the case by them, and they guide me through everything. And it was a great experience. So to always have that support between our seniors, between our attendings, was fantastic.
I've been there fumbling for the phone number, like, who do I call? I've been freaking out.
Mind you, that was his first month as an intern.
Help!
Yeah, I think it definitely helped being at a program where everyone was supportive, from attendings to residents, in all years. Especially because I hadn't seen an adult patient in almost a year before starting my MICU block second month of intern year. So I was like, it's gonna be interesting. I'm gonna take care of sick patients, and I haven't touched an adult since September of last year. So again, my senior was an EM senior, not an IM senior, so I went a long way in terms of guiding me through any lines or procedures I had to do, and also just sitting down and doing teaching. But I'll say if you're just going into intern year, literally no one expects you to know anything, and take advantage of that. You can be as as stupid as you want to be, and everyone just expects you to be, because at every institution you're going, any hospital you're going, you have to learn the system first, and that takes some time. I think after maybe 6 to 7 months, I felt like I'm somewhat got some of the sense of the system, and I still am. I'm still getting played by nurses and techs till this day, and I'm figuring out little tricks that people try to do and pull on you as an intern. So that's one, and then you start like learning and getting comfortable with like not only like the medicine, but like how you practice that medicine within that system. So don't rush anything. It's all a process. People don't expect you to be like know everything. They just expect you to, one, be coachable, to work hard, and to really care and try your best. And I think if you do all those things, it goes a long way.
Man, you said tricks they play on you? Dang.
Right. Why they play
Here,
tricks?
hold on. Give us an example. Because I heard.
Shoot, the one I'm thinking latest is like, it comes to the burn. Like nurses are supposed to be taking down wounds for you and like calling you on the phone to come look at it, and then they would dress it back up. And I just remember one nurse like, you know, like take all down the wound. You take it down, and then you look at it and you put it back together. I'm like, well, it doesn't sound right.
Something's off here, you know.
I'm like, wait, how come you're not gonna take that? She's like, you're a doctor, aren't you? You're supposed to do it. And then like the fellow came was like, no,
playing Candy Crush, and you're like,
Yeah.
Yeah, I am. You're right. Yeah. Yeah.
That's psychology 101. Oh my goodness.
Sus. Y'all been having some experiences with that burn unit. What's going on?
That's hilarious.
Oh man. So wait, what did you end up doing? Did you end up taking it off and doing it?
Yeah, I did.
How soon did you find out after the fact that you weren't?
Very soon, because she was like, oh, I'm so busy, and then like I would start doing it, and then it felt bad, so this other nurse came in and helped me do it. And then she's like, some of these nurses just want to push meds and do nothing else.
That's nice.
No.
That's true.
Now we all know. Now you've empowered us. I'm be like, you know what? Nah, you're supposed to.
I mean,
in the nicest way. Honestly,
sorry, I was thinking. Then again, it's kind of hard because when you're new to a system, you sometimes don't know what you're doing, or like what's the history, unfortunately, what's the culture of that system, and so it falls upon the intern, falls upon the doctor versus what like what nurses or some ancillary staff do. So, I'm like a learning person.
Loki, even now that I know it, I still don't think I'll be able to say no. I'm like, I'm so new. Like, I gotta just
no.
No, you gotta
really?
No.
I kind of the same way. I kind of say yes to things like I want to get it done. But sometimes point out like you're gonna burn out even faster if you let people push things onto you.
Just do it. Oh man.
All
right, words.
Yeah, like another recent example was like we needed this guy to get rectal contrast for CT abdomen pelvis, and that's like not a thing residents or doctors should do. That should be on text. But for some reason, you got to go into radiology, put in the rectal tube, and put down the contrast. And I'm like, I got to do that. Like, yeah, you got to do that. I go back to talk to my tenant, like, this needs to be done. He's like, okay, so like talk to colorectal and get it done if that's what the procedure they want. I'm like trying to talk to him with phone. And like, all right, so like, okay, so set it up. So let's know what the read goes. I'm like, okay, I guess I'll go do that and leave the ED. And he picks up the phone. He's like, no, you're not doing that. You're gonna talk to them and coordinate with them to make sure they do it, and you can just be here.
You getting played, my dog.
Yeah, left and right, taking L's.
Oh my goodness.
But sure, I didn't do it. Colorectal came down and did it.
Good.
Like, spoke with them, coordinated with them. So that's the thing. Just learn to say no and understand like kind of what's in your realm and your scope of practice.
Right. How about you, Carlos?
Yeah, no, I think one point that Yoni made that I definitely agree with and think it's important to like think about as an intern, like, finishing med school, like you're the doc now, you got the long white coat, and you at least for me, and I feel like other people I've talked to too, it's you put a lot of responsibility on yourself, and sometimes you feel like you expect yourself to know everything, and you feel guilty or bad, or like you're not a good doctor if you don't know something. And we're still training, and it's a process. And intern year is a huge jump from being a med student, but it's also your first year of 3, 4, 5 years training, and to recognize that and to be okay with not knowing things, but just, using that as an opportunity to learn and utilize your seniors and your attendings who are there to teach you, because you don't know everything yet. And, not to be too hard on yourself for, making a mistake or not knowing something.
Right. Yeah, man. So, Chichi or Adama, any questions for y'all? Otherwise, I can move on.
I think.
Oh,
Go ahead.
go ahead.
I mean, for me, I'm just like, even during third and fourth year, I like what you got kind of just said, Carlos, the whole thing of like being so hard on yourself. How do you find that balance of like, quote unquote, so what was said before, of like allowing yourself to be stupid, but also like understanding the responsibilities you have? Like, I don't know, it's just so hard because I'm like, you have gone through medical school, so you should know some stuff, ideally. And then coming in and then them kind of expecting you to not know anything, but then, I don't know, you're still gonna be a doctor, so you should be studying and knowing things. Like, I don't know, it just seems like a very hard
mixed bag.
Yeah.
I
don't know if you guys have any comments.
I'll comment a little bit maybe. So I think what I mean, it's like you're gonna know things from medical school. Yeah, it's like you kind of should already know, kind of a little bit know who's sick and who's not sick. You kind of already know like your ABCs, like really, like the basic things. I think the things that like no one really expects you to know is like like dosages of medications, or like antibiotic regimens, like how long you give an antibiotic for how day. But like to at least like when you come and present, be like, hey, like this person will need antibiotics. I can like look up exactly like what we treat them with and for how long and the course. It's just like kind of understanding where like where your knowledge gaps are, and to understand like you may not even know yet where some of them are, but just understanding like how much you know, and like understanding it's okay for you to right now have limitations, and like to be okay to say, hey, listen, I don't know. And that's like kind of safe practice for your patients as well. And it's the same time for you to like be like, hey, I'm gonna go look this up. They love that when you just be like, hey, I don't know, but I'm gonna go look it up and I'll get back to you, and then you can confirm or tell me no, that's actually wrong. But that's it.
Agreed. Because it comes down to like honesty, and honestly, nobody who knows everything. I've seen attendings, like OG attendings, who don't know certain things, you know what I mean? Whereas they know a lot of other things. And so, like Yoni said, saying I don't know is actually much more powerful than you can imagine. When you're in medical school, it's tough because in your head, you're expected to know everything because you need to look as good as possible. You need to get this interview or residency spot or whatever it may be. But when you're a resident, you're like, okay, I'm here now. I'm in training. I'm trying to learn as much as I can for my patients. And so, it comes down to just understanding that you don't know everything, but you're going to keep knowing more and more and more. One thing that one of my favorite attendings used to tell me, this is an attending who I had like the majority of my princess shifts with. He's like, look, John, when you see these patients, you got to understand something. It's all about evaluation, management, disposition. I don't know if you guys have had that talk, Yoni and Carlos.
Oh yeah, I know you're talking. I think I know you're talking.
So it's like, all about
yeah, exactly.
Patient, it's like we have a framework, right, that'll keep improving, but you got to evaluate the patient. You got to do your history. You got to do your physical exam. You got to see what's going on. Evaluate them. For your management, it's like, okay, I figured out this is what's going on. This is some of how I want to manage it. I want to get these labs. I want to get this imaging. I want to do this. And then it's like, okay, I've done my evaluation. I've done my management. Here comes the disposition. It's like, are they going to need a consult and stay in the hospital? Are they going to need to rush to the OR? Are they going to go home with follow-up with the PCP? What's going to happen for their disposition? And so that's one patient. You evaluated them, you manage them, and then you're trying to get a dispo on them. And then as you become more senior, you realize, okay, now I have more patients. I need to evaluate, manage, and dispo more patients. And then as you get to that high level senior, you're not just doing it for your few patients, you're doing it for the whole room. And then you're moving the whole room, and you're obtaining kind of the flow of the whole room. And so nobody's expecting you to do that as an intern, but slowly and surely you'll get better at doing that stuff. And so understanding you always have help in the trend alone is good, despite that you won't know everything.
Can I add something? I think it's really important as an intern. I had a talk from someone that I really value as a mentor. She said, this is your first time being a medical doctor, and the first half of intern year, more people, maybe like 3/4 of intern year, you're going to feel really lost because yes, you've learned and you've read, but you haven't seen all of these things in person. So what they look like on textbook might look very different than what the patient looks like when they present. So the first couple of months, I would say most important thing is just knowing sick versus not sick. Does this person look really, really sick? Or do they look like they can go home? But also keep an open mind, because I've had people that don't look sick at all and they're like on their deathbed and based on their labs, but looking at them, they look great. And then like the next day they expire, versus like you have people that look expire, I mean like pass away. And you have people that like look sick as all get out, but then you look at their labs and they're like practically healthy. It's probably like a little flu or something. Well, not a little flu because that's something, but you know what I mean. So yeah, sick, not sick. And then also for getting played by nurses and tricked, sorry, Yoni. I think it's very important as an intern too, especially as an African-American in the healthcare professional world. There's going to be a lot of times where you are the only person of color in an institution or in a space. And so I think it's very important that early on you do set boundaries. And I know for me personally, it's really hard to say no, but especially when it comes to nursing and especially in front of your patient. Me personally, I'm like, ooh, I don't want to be known as like the person who like brought the tray, because that's the CNA's job, or the person that like changed the IV or like hooked the bag up, because then the patient will be like, okay, that's the nurse, versus like, no, this is my provider who's like practicing. Well, nurse is a provider, but this is my doctor who's making an action plan for me. So I hope that try and set boundaries early on, because some nurses, especially those that feel some type of way about your rich melanin skin, they will try to play you. So you need to let them know real quick, we can work together. We are a team, but I am not the one. But you can be nice about it. Be nice, because those nurses, those nurses can
they
mess
control
your
everything, huh?
up.
I've heard stories.
Have you doing the colorectal enema?
Oh man, you know, like how'd I get here, man? But dope. So kind of moving on. I want to ask y'all generally about highs and lows of your year. If you could kind of pinpoint one high or one low, or just talk about you know, a potential high and low, and tell us how you managed the lows and what was kind of you know, what happened with the high. Anybody can go ahead and start. Or if it was all just a big low, you can say that too.
No.
I have one. So a low, I was in the department. This is about mid-year or so. I'm working with an attending who shall not be named, and we have a patient coming in with, you know, suspected cellulitis on the back with potential abscess formation, some induration. You know, the guy wasn't too sick, but it's like, okay, he has this big thing on his back. We need to probably try to IND it. And I go in there and, you know, I evaluate, manage, come out, tell the attending what's going on. She's like, yeah, I mean, just cut into it. You know, I'm like, okay. And so I prepare all my materials, go in there, and I try to cut into this thing. This guy's back, and it's a pretty wide area, but it's very, very, very indurated. So there's not much fluid. I take an ultrasound to it beforehand to look for any pockets. And I cut into it, get as much as I can out, and kind of go back. The attending's busy, kind of talking, doing her thing. And so I just like run it by the senior real quick, let them know what happened. We're kind of just continuing the plan. Later on, the attending's like, hey, did you cut into it? And I'm like, well, kind of. And she's like, and this is in front of like other attendings, one of our like rotators who's there, some residents. And I was like, well, kind of. She's like, what do you mean kind of? And I was like, well, it was a little difficult. And she's like, what do you mean? I don't almost know how to even tell the story, but essentially she's like, what do you mean? Like, don't act stupid. Like, it's not hard. And I'm just like, no, I'm not saying it was difficult to do. I'm saying it was physically difficult to cut into the induration. There wasn't much fluid and it was very, very hard physically. And she's like, look, when I tell you to do something, you do it. You're the intern. I'm the attending.
Oh no.
And I'm just like, you go through and sometimes you'll have these moments in intern year where you're like, yes, I'm an intern. Yes, they're attending, but I'm also a human being, adult male.
Yeah.
You're not any type of way.
Right.
So
No.
I'm just like, okay, no problem. And I go back in, I extend the incision, don't really get much fluid out. We go about our day, we disbone with some antibiotics, he's all good. But in that moment, I was like, you know what, there's no need to really talk to anybody like that, to disrespect anybody. You could have pulled me to the side, you could have talked to me later.
Right.
Instead of essentially doing this in front of the whole department. And I really didn't like that. I didn't appreciate that. And I've had other moments with this particular attending throughout the year. And I've always, each year it's become progressively me just being more respectful, like to just like kill it with kindness, kind of thing. But that's just one of those times where it's like, that wasn't necessary, you know? The positive I will take from that is that I'm generally a very kind, respectful person. And when that happens and when I'm faced with that kind of adversity, I'm not gonna do what they're doing to me. I'm gonna maintain a line. And so that's worked very the year. I'd say I've had a bunch of different highs throughout the year. Like this year has been truly incredible, from different procedures I've done, to kind of calling, you know, diagnosing different things. But one really subtle high that I had was when I was actually on my general medicine rotation. We had a patient who I guess had come to the ER with syncope. They worked him up, everything was negative, they sent him home. Similar thing happens a few days later and he comes back in and he gets admitted to the hospital because they're not really sure what's going on, but he has like I don't know if it was like a subtherapeutic Dilantin level. He has a seizure history, and maybe it's at his I think it was like his Kepler level, maybe was like really, really elevated. We work him up and I get the sense that, you know, this guy's kind of just off, a little weird. And I talked to my senior, I'm like, hey, you know, I talked to him, everything's okay on physical exam, but you know, something's just off. He's kind of a weird guy. It's hard to describe like clinically. And she's like, okay, well, you know, do you want to do like a mini mental status exam? Which isn't something I've at least ever done in the ER. Like, I don't think we really do that in the ER. You know, we don't really have time, and that's not, you know, if it's, how is it a life threat kind of thing, you know? And so I do it and he fails. And I'm like, And, you know, he couldn't really read, he couldn't write too much other than his name. And we realized that he's illiterate. And social work sees him, and, you know, neuro and psych see him, and they realized that when the ED, that first time he left, when they were like, make sure you take, because he came in, I think, with a subtherapeutic level, and they told him, you know, make sure you take all of your medication. He literally went home and took all of his medication. And
oh no,
because he couldn't understand, you know, the words on his pill bottle. And everybody missed that. Everybody missed that until we did the mini mental status and realized this guy's literally illiterate. And growing up, having a standard of education, you don't really, you hear that that's a thing, but you don't really see it often, you know?
Wow.
And so I was like, wow, he literally can't read his medications. He doesn't know how to take them, and nobody ever explained this to him. Pharmacy didn't explain it to him. Nobody caught this. You know, he doesn't have a pill bottle. And it was an easy thing to fix, but it was a potentially disastrous mistake that didn't need to happen. And so it was nice to just have that little extra time to figure out what was going on with this gentleman and get him the help he needed. And it's something that I appreciated for my general medicine rotation, because in the ER, that's not something, you know, maybe I would have done. It'd be easy to miss that time and time again. And so I've had many different highs on many different rotations, definitely in ER, but I find that I'm taking little things from each rotation, whether I want to be there or not. There's something you could learn from everything. So that's the one thing that I really appreciate this year. It taught me to just slow down a little bit and consider other.
Word.
I bet you that attending didn't say nothing that time.
Man, I would say I've known John for several years, man. You're definitely kind and respectful. So, you know, I appreciate that. That was how you handled it, you know? Yeah. Anybody else, any highs and lows?
Yeah, I can talk about a low. During like my first month of like inpatient medicine wards, I think so part of the learning curve of like being an intern is like learning how the hospital works and like the system works. And also like medicine wards, you have like these long hours and that, so you're working, 12-hour days, a lot of days, 6 days a week. And my patients were like were having like extended like hospital like stays, and things weren't getting done because of like systems issues, like transport wouldn't come on time, they would miss their echo and stay an extra day, or we couldn't find them placement. And I was finding myself like frustrated and just angry like the whole day, every day, because I felt like I'm putting in the orders and these things should be getting done and they're not. And I found myself like just very frustrated with I don't know, myself in the system. And I, talked to some people, took some time to kind of reflect on that. And, I think I didn't recognize, I think coming into like intern year as a med student, you present and sometimes you can put in orders, but you don't, you kind of just things get done magically, like as a med student. And as an intern, a lot of that stuff that is behind the scenes work. And there's a big learning curve on like working within the system and like figuring out how to do that. And I didn't recognize that. It made me really frustrated. And when I kind of took that as a challenge, like upon myself, like I think there's a lot of like changes that could be made in our like medical system and in our hospital to improve patient care. But those are challenges that I'm not able to fully tackle right now as an intern. What I can do right now is figure out how I can function best within the current system, and in the future can take on those larger systemic issues. And after kind of doing that, I've found myself happier, having some autonomy in the situations, recognizing what I can do in those situations. And then I can talk about, let's see, got a couple highs, but I think one of the highs that I had was in the ICU. I was like doing night float, and it's like midway through the night, it's like 3 in the morning, and I kind of look around and my senior is like, he's like sleeping, and I realize like I'm running this ICU 20 patient bed ICU right now, and my senior a couple hours later says, man, like I didn't have to do anything last night. Like you had it down, like you had all this. And I think like in that moment I recognized like, all right, I'm like learning stuff. I'm not just, presenting and putting in orders that my attending says okay on. Like I'm, actually finally becoming, more of a doctor. And so I think you'll see those moments throughout the year where you kind of recognize, I think the day in, day out, the transition is slow and you don't recognize it, but every now and then you'll see these glimpses of your progress, which is exciting and important to like recognize those and like cherish those moments.
Word. Yoni, anything?
We've taken many L's this intern year. I can't really point to a specific one. But most things sort of John and Carlos have highlighted, I've also dealt with. So I'll touch about something else. I think one thing kind of a low this whole year has been is not being able to see family as much as I could back home in Toronto. I think med school is kind of easy. I can go back every like 3 months, every 4 months with all the breaks that you get. But now, like, especially with the pandemic, I know it's like I haven't seen my family like 7 months, close to that. And that's like kind of long for me, especially because I grew up at home. I stayed at home for college and like lived with my family. So that's like been like the most difficult thing is like not seeing friends and family as much as I used to or used to am seeing. But kind of been trying to manage that by also I gotta do better like FaceTiming and like calling and texting and group chats. But what's helped with that is kind of like again like that intern month of getting to know my co-interns and co-residents and getting to hang out with them outside of the hospital. And also Chicago's a great city So I've been taking full advantage of the city itself. And then to that being said, is like intern year is gonna be tough no matter where you go. Certain programs obviously lend themselves to being tougher than others. But I would say sort of find something outside of the hospital to do no matter what, and stick to it. So I found things that I enjoy and then I haven't let go of. But coronavirus put a halt on some of those things, so I don't appreciate that. But we'll be back to them after sort of things died down. So that's that. High for me, and this goes back to the whole like knowing your limitations and then kind of like understand that you do know some things. And as the intern goes throughout the year, like Carlos and John have said, you start learning things, and then you start like, hey, I can make decisions. So very recently, it was like a Saturday evening on like the high acuity section of the ED. We're rounding. I'm like Tenny's like, well, why don't you round with us instead of picking up new patients? We're rounding. He gets handed an EKG. He just looks at it and hands it to me. He's like, give me 1 second, I'll go in this room. I'll come back out. Like, tell me what you think. And I look at him like, oh, it's kind of concerning for some like possible, ischemia, maybe having a heart attack. And he's like, yeah, you're right. I think it is this. What do you want to do next? I'm like, well, this could be old. This could be new. With compared to prior is usually what you do. He has no prior in the system. So he's like, what do you want to do next? I'm like, go and get his ass over into one of the one of the stations, and listen to what he has to say. I was like, okay, great, okay, go do that. So I get him into the station. I asked him, text, hey, can you pull this patient back? I get him. I talk to him. His story is very concerning for an MI because like as classic as you can get. He's been saying I have chest pain for 3 days. It's kind of getting worse. It got worse. The first day I had it, but it's still lingering. It's still there. It's worth
3 days.
Yeah. So a sad thing at our hospital, a lot of people present pretty late for the things that they're supposed to be presenting for early, and a lot of times they present super early for things they're not supposed to be presenting for at all. So he's like, yeah, 3 days, and he's like, now my left arm is getting numb. So I'm like, oh, this is not great. So I quickly grabbed the ultrasound probe. I put on his heart, and then which kind of great is we get like all the ultrasound experience. I look at his squeeze, and it's like it's not the greatest. It's not terrible. Maybe moderate, whatever. But what I thought was more concerning was I thought like regional wall abnormality on the ultrasound. I'm like, with his story, with that ultrasound finding, like I definitely should call cards. So then I went back to my attending. I'm like, look, this is his story. It's concerning, but also my ultrasound. This is what I saw. This is what I do. I'm like, I'm going to call cards right away. He's like, okay, cool. Like, this is what you do. You don't do a STEMI activation, but you call the cards fellow directly, so they can come down faster. I call the cards fellow. They come down right away. They see the same ultrasound findings I saw as well. Eventually, as things kind of everything starts coming back for him as well in a short period of time. They take him to the cath lab. He ended up having like 100% stenosis of his RCA, and that's where his infarct was, and that's where I saw the regional wall abnormality. And that was like kind of a high for me because like I really felt like I was making all these decisions, and that same attending at the end is like, oh my god, you, like attendants, you did like a great job. Like you called something, you saw something on your finding, you spoke it to them, you related to them, and then that made them come down. And that was big because like just a week ago, I thought I saw regional wall on another heart chest patient of mine. He also did get admitted. Also eventually like spent 2 days on the floors and then went to the cath lab. And I read the echo report, and right where they saw the abnormality is also what I saw on bedside. But I felt like, how can I be making this call as an intern? And what it taught me is like, making that call is not going to hurt the patient or anything like that. Like, what do? You call it, and what, you're wrong that you didn't see anything on your ultrasound finding, but you call the correct consultant for him with that story that's concerning. So just like believe in yourself and be confident. That confidence is going to grow throughout your intern year, and it's going to continue to go throughout residency as long as you try to put in the effort and put in the time. So I think that was my high. I'm like, I'm a doctor.
Yeah, that's definitely, all these highs are definitely very inspiring. I'm out here like, man, when is that moment gonna come for me, you know? And I'm excited for it, but I'm also like, yo, I know it's gonna be hard work, like y'all said. We'll see. Hopefully a year from now, I'll make a video like, yo, y'all, everything y'all said was right.
Peter, we made it. The nurse tried to play me, but I said,
I said, refer to this Black Kids White Coats video. Look what they said. No, so okay, so kind of moving on to like a more practical kind of question. So step 3, right? That's a test that our interns got to take. When did y'all take it? Any advice? And how'd y'all prepare?
I think Yoni's the only one that's taken it.
Oh, word.
Oh.
Yeah, I took it for immigration purposes. I had to, so great. Okay, for anybody out there who is not an American citizen, has no green card or no like permanent residency card, so since coming from Canada, I was on a F1 student visa. And for those of you watching, what you can do is you can get your school to sponsor you for an H1, not H1, you get for an OPT extension. And that OPT extension will last you a year. It can last you up to 3 years if you do like another 2-year extension after that. You get that 1-year OPT extension, and then you can like practice medicine on your student visa. And who's going to be sponsoring that OPT extension is your home medical school institution. You're just going to have to make sure that your current where you're doing actually your program, it just says like, yeah, this person's like actually here, an actual doctor. So it buys you a year to then study for step 3, and then for your school to then sponsor you for either a J1 or H1B visa. Fortunately, my institution sponsors H1B visas, but again, you need that step 3 for that. So I took step 3, luckily in like February, just before they kind of shut things down in March. The way I study for that is about UWorld. I did like as many questions I could possibly do on UWorld within like a month period, and went through like the virtual cases. I think what's more important is going through the virtual cases more than the questions, because you kind of want to get used to like that kind of software and how you actually go through cases, because it's not as intuitive as you think it would be. But surprisingly enough, especially when you're coming from like IM, especially when you're doing a prelim year in medicine or ED, it's kind of not that hard to do the questions, because you're like, oh, yeah, I kind of do this in practice already. And especially if you're doing it as a second or third year in IM, or even in med peds or ED, it kind of gets easier when I spoke with some of the like upper class, some of the senior residents.
Word.
Yeah. I scheduled. So my wife took hers, and I was like, for ER, especially because we're 4 years, like I don't have to take it right now. Like our program isn't putting pressure on us to take it right now. You can wait. And so I was like, you know what? She took hers. Let me just like get on the same page and like take mine too, so we could just have it done. And then, coronavirus happens, and I guess it was a point where like they canceled maybe every other person's exam. So I was the unlucky 50%. And they're like, yep, and this is 2 weeks before my exam. So I had studied, I was ready to go. And they're like, hey, your exam's canceled. And I'm just like, and it got to the point where like Prometric had like shut down their phone line. So you couldn't even call them. Like you called them, it went to the like, we're not answering.
Right.
So finally I was just like, you know what, it's cool. Like I'll just push it back. So I pushed it back like 6 months to the first opening. And luckily we had our 2nd year schedule. So I tried to put it in a time where we'll have some open time for me to like kind of study again and take it. So that's just what I have to do. But like Yoni said, luckily, we're seeing a lot of this stuff every day in practice. And I agree, like that kind of virtual patient interaction portion was not intuitive at all. I'm just like, per next hour, like what's happening, where's my lab result? Like it's not intuitive. It actually makes no sense, but you got to do it so you can figure out how to work it. Yeah.
Man. Yeah, Dama.
Okay, so I took step 3 in November, only because my program gave $1,000 bonus if you took it by December of your intern year. So I'm sorry, like the way we was getting paid, I don't have to pay rent. I was looking real poor, so I was like, I got to take this test as soon as possible. So I feel like if you are a like primary care, like EM, FM, TY, prelim, you can afford to take the test later, only because we're seeing these things every day in our practice. And so the more you see it, the more you'll get acclimated to it. So I used UWorld, but you're also seeing these things in real life. But for my specialists out there, people that are going into subspecialties that won't get that much primary care, I would advise taking it earlier rather than later, because it is very like internal medicine, primary care heavy. So if you're not really seeing this stuff, it's going to be harder for you if you wait longer to take it. Not saying you won't do well, but you just want to set yourself in a position to get the highest score possible. So I took it in November. My brother, who's an ortho intern, took his in May, because California, our schedule is kind of ghetto. So things opened up. He slipped in, took it, and he did fine. But yeah, my biggest advice for step 3 is don't freak out about it. It is hard because you are working, but you have to trust that you're doing the work in your real life, so that it's okay if you don't do all the questions in your world. You'll still be fine. But know your biostats. Because
Still,
sis, there's a whole other, like, there's like the clinical case modules on UWorld, there's like the actual question bank, and then there's a whole separate biostats. So that should tell you the biostats is important. And my biostats
Never goes away.
is non-existent. And I'm trash at biostats. I've been straight basura. That means trash. It's just trash. And I dabbled a little bit on the UWorld module, and that was like 50% of my tests. So
the test hit you with all the formulas and everything.
I got pimp slapped. I was like, real ratio, MPP. What is the confidence, power? I think I have enough power. I don't know. I mean, I tried, so I made it. But please know your biostats, because for me, I was like, and my brother knew his biostats. So yeah, please know your biostats, because don't be like me, even though I still passed. But yeah, do your biostats. Yeah, please.
Nah, that sounds stressful.
Yeah,
definitely taking notes on that.
Yeah, no, I'm serious. Please study biostats.
All right.
Yeah.
Okay.
Yeah, so Carlos, what? Oh, sorry. Go ahead.
Sorry.
Go ahead.
Oh wait, Carlos? Did you get to answer? I'm sorry.
When do you plan to take it?
What's that?
When do you plan to take it, step 3?
It seems like most people at our program are taking it either like 3rd year or 4th year. So I don't have any.
So you have that long to take it?
Yeah.
Oh, word. Okay. I guess for me, I've always been pushed to kind of take it the first year.
Yeah, because you're doing a TY, I think.
Right.
Mm-hmm.
Yeah. Got it. I didn't know. Okay, I didn't know that. I just always thought first year was the deadline.
Like it's better to take it early if, surgical subspecialty or kind of something where you're not going to see a lot of that primary material.
Right.
Especially because you'll forget from med school. But I think generally you have to just have it done before you graduate so that you can do your life.
That's good to know.
Word. That's good to know. Okay, good. Sorry, Lily, what were you gonna say?
I know. I just had a question, and like we can like finish up and all that stuff, because I know y'all have to go sleep and get ready for
we're in that
real
hour
life
mark
stuff.
Yeah.
But just a final question about burnout, and because I think that was the main thing for me. Like I'm scared, because I'm just like, am I gonna burn out? And like, did you burn out? If you did, what did you do to manage that? Or how do you prevent all of that from happening? We talked a lot about highs and lows, but I would imagine like if you continuously face these lows, like that probably is not good for you as well. So if you guys can talk a little bit about burnout, and then we'll kind of wrap things up.
We actually just had a really, really great lecture on burnout. It was phenomenal. I guess we're not sharing that with the public, but I'd say definitely look for a program where you have great lectures, great conference, because it was really good and really educational. Burnout is a real thing. It really happens. There are different ways to describe it. I'd say personally, I was fortunate to not experience it, but I do have loved ones and friends who did experience it, from med school to residency and beyond. In my experience with burnout, I'd say kind of grinding, kind of nonstop, trying to do your best constantly without realizing that you have to take time for yourself is one way to get there. And getting out is difficult because you have to know yourself. You have to know kind of what you need to do, right, to get back to your baseline. I'd say for me, and this goes back to kind of part of the reason I picked EM, is because I wanted my own time. I want structure, but I also love that shift kind of schedule. I love that I'm seeing many different things all the time. So I enjoy my field, especially, and I think it's really fun. So that's kind of the work side. But outside of work, I mean, I'm a hobbies kind of guy. Like I've had hobbies my whole life. All I do is hobbies when I'm not working, you know? And I'm not talking about just like cooking and going to the gym and sleeping. Like I love doing tons of stuff from biking to anime, manga, like reading books, podcasts, music. Like there's so much to do in the world that when this pandemic started, people were like, oh, I'm so bored inside. And there were interns who were getting put on like standby. So they got a 2-week vacation. And I'm like, oh, I think, you know, we're about to be COVID team 5 for medicine because I'm a general medicine. I'm like, I think we're up next for this standby. And then they're like, psych, we're flexing you up to the ICU. And I was like, oh, okay. But, you know, for me, when I did have my vacation, you know, although I was visiting my wife and everything, I enjoyed just being by myself, doing my own thing when she was at work. And that's just who I am. I'm an extroverted introvert. So, I mean, I love going out and hanging out with my friends, seeing my family, but I also love having my own time to do what it is I want to do. And so I'd say to help prevent burnout, the advice I would give is try to find things that you truly enjoy, whether that's one thing or many things. You know, don't let it overburden you, but definitely try to just find things that you enjoy and make sure you do those things. Because it's when you push those things off and push it off and push it off and say, well, you know, I have to work and I have to do this and this. You're not living and enjoying yourself, doing the things that bring you happiness, you know. So make sure you keep those things close, because they'll definitely help. And you know, having support helps too. Like God has been incredible this year, you know, and I've really increased my faith this year. Family, my friends, even without being able to see them and physically be there, having them FaceTime me, send me messages, just be there, kind of with that emotional support has been amazing as well. So those are my tips.
Awesome. Yo, your activity, I'm sure your activity section on ERAS was lit.
Super
Yeah,
lit.
paragraphs.
And that stuff came up at the interview too, man.
Oh, yeah, always does.
Stories, they're like, yo, I have to get into this stuff. Like, this is fire. And I'm like,
Right.
you know?
Right. Carlos, Yoni?
Yeah, shoot, I think I experienced burnout in med school. Probably, shoot, I think the lowest point was like halfway through third year. I was, I'm through this shit. And I mean, when I hit that point, I think I waited too long, but I reached out. Luckily, our school had great like support system for that as well. So I was able to see someone for that and work through it. And then I started turning in the right direction, and then kind of went into fourth year. Like, all right, I'm gonna just do it on my sub eyes. I'm gonna like try to just do it. And after this, I'm just gonna enjoy fourth year and make sure I just really relax. And the whole did I relax? I just used whatever low money I had to go on like multiple trips. I think I went to like 7 countries in like 4 months. Yeah, really enjoyed myself and tried to relax as much as possible before intern year. And then what really helped, especially coming to this program, was again like John Carson both said, people here are very supportive. Another thing I like is that like it's a pretty diverse program. You see people from all walks of life. You see, and again, like our IM colleagues, majority of them are international. The staffing here, again, like you'll see again, like of course, it's medicine, so you won't see many black faces as attendings. But I've definitely seen more black faces as attendings here, more brown faces as attendings here than I've seen at my own home institution. And even the nurses. So it was kind of nice to be like, huh, okay, like it isn't just like a sea of white, you know, or the black people aren't just like the janitors or the tanks, or like, and there's nothing wrong with that, but at least you can kind of see them in different positions within the hospital. So that also again helped me, and it made me feel more comfortable. I didn't feel so uncomfortable being in my skin in the hospital, as more so I just felt uncomfortable being a new doctor, and that was my main uncomfort, which again goes a long way. And then like learning to say, hey, like yeah, I'm not well, or I'm not okay, or like I'm kind of frustrated. And usually I've been a person that doesn't say anything, it keeps it all bottled in. But like intern year, when like a senior might ask me, hey man, you good? I'm like, no, actually I'm not good. I'm kind of frustrated with this right now. And then like talking through it with them and like, okay, great, got that off my chest, cool. And like not, because everybody's here to support you, and they should be there to support you. And luckily it's kind of been true here. So to that point is like reach out early, and especially if things kind of learn, reach out. So I made sure to reach out to my PD this year and it's like put him on notice just so it won't be a surprise later down the line. I reached out to seniors like who already gone through my program, and then being open and honest with it. And then again, like John has a lot of hobbies. I find things that I love and I don't let go of them. I need to be better at answering my email because when I'm out at work, the inbox is growing because I really want my time. But yeah, so just like you gotta just find things that you enjoy and try your best and let go of them. And it's easy for us in EM, to do that because I feel like compared to other programs, as we do shift work, we have a little more free time than everyone else. And I think it's a lot harder if you're in a surgical specialty. But for that, I pick one thing. I don't know. I feel bad. I can't give you much advice on that because it's going to be a different beast in itself.
Thank you for that, Carlos.
Nice. Yeah, no, I mean, I agree with what both Yoni and John have said. I mean, I think, recognizing it and kind of keeping a, sense of your barometer and like recognizing like, burnout can happen to you too. You might be, see like, how am I feeling today? Do I feel burnt out today? Recognizing that, that it can happen and being quick to, talk to your colleagues, your leadership in your department. And yeah, luckily at our program, our attendings and our leadership are very supportive. And then, in professional help too, whether if it's a psychiatrist or a therapist, reaching out and finding someone professionally to talk to too. I haven't, but I know colleagues that have therapists that they see, every week, every other week, to talk through what they're going through. I would say that I haven't experienced like full burnout, but definitely like peri burnout, like, where it's a little harder to get up and go to work and be excited each day. What I've done, like reflected a bit, and I found that, sometimes I'll be like, oh man, like this is another chart I need to write, like another patient that's going to take time away from, from my day of these, getting these other tasks done. And sometimes checking myself and taking a second to, recalibrate and be like, this is a person, this is a patient, this is someone I can help in this moment and not get it. And sometimes that line, you cross that line where you minimize or maybe forget for a moment that this is a person that's sick and is looking for you for help. And, it's not just more work for you. It's a moment you can, intervene and help and make a big difference in someone's life. So that's like a tool that I will utilize sometimes when I'm feeling tired. And then I have hobbies too. I bike, I work out and try and I've recognized that that's really important for my happiness. And even when I'm feeling tired and want to just sit on my couch and not do anything, which is okay sometimes. Like sometimes you need that. Sometimes you need to just binge on Netflix for your day off. But to also try and do those things, even if it, it's hard to get up and go on a run or go see your friends or, call your family or whatever, to, make an effort to do that. But then also you don't feel guilty if it doesn't happen one day,
Man, I'm over here taking notes. Adama, yeah, go ahead.
So I experienced burnout, like legit full on burnout, maybe about 3-4 months ago. And it was bad. And it was like right at the start of COVID. And for some reason, my hospital got hit like really, really hard in California. So long story short, all of my coworkers that I was on wards. So obviously we were the ones that were taking care of the patients. All of my coworkers were getting COVID. And so when you're like, I'm literally working right next to this person and they coughing and sneezing and we don't got the N95s because this was when there was a shortage. And then we're
Mhm.
texting each other like, oh my gosh, I just got texted, I'm positive. And just being in that environment, I remember being like so over it, to the point where I was just like, is this for me? Like, do I belong here? I could not get out of bed. I really love going out with my friends. I just had no energy to do anything. I don't want to do anything. Patients would be admitted and I'd be like, what are your symptoms? Like, I just did, like, I'm just gonna be frank, I did not care. And although I have nice co-residents, like amazing co-residents and faculty, for me personally, there's something about having someone that like looks like you, meaning like for me, a Black person, because I can use lingo and like really just be myself. That just for me, like I could be like, yo, this hitter right here getting on my nerves. Like I can't really say that to like a melanated coworker, for me personally, just at my program. So for me, it was really hard for maybe about like 3 months. I had no motivation. And I think for those of you that will experience burnout, that are experiencing burnout, I'm currently no longer burnt out. I can confirm that. What helped me was just being easy on myself. And like if I wanted to stay in bed all day, I stayed in bed all day. And that's okay. And giving yourself room to just do what it is that you want to do. Sometimes I did have to force myself to get up and go hang out with friends. For me personally, I would advise keeping a strong core group of friends that are not in medicine, because medicine is something that you do. It shouldn't all encompass you and be who you are. So for me, hanging out with those friends that were not in medicine that could pull me out and be like, yo, Adama, like, you're a regular person. We're going to have fun. We're not going to talk about work. And just allowing yourself to be in the presence of people that fuel you and give you energy and fill your spirit. Keep those people and cherish them and be good friends to them too, because medicine can cause people to be really selfish. So keeping those friends close and really, really, really protecting your energy and not allowing people to take from you things that you do not have. And slowly but surely, you'll start to notice, at least in my case, I was like, okay, I do want to go out more. And I am excited to see this patient. And oh my gosh, this patient in clinic, like we're vibing right now and I'm having so much fun. And then it's kind of like a relationship. Like sometimes you're like, man, I'm trying to get a divorce. But then you go to counseling a little bit, go with your friends a little bit, see your therapist. And then slowly but surely, you'll find your way back in love. But it's a journey. So just embrace the journey. And I'm sorry if you're burnt out. It sucks. It sucks. So I'm sorry.
And just as to
Yeah.
Adele's point in terms of like protecting your energy and being easy on yourself, like that, being easy on yourself is, again, it's going to be hard, especially when you just become a doctor. Now you're like, oh, I got to make decisions and stuff like that, and you don't know, and you're like, how do you not know that? Like, just remember, it's your first time doing it. Everybody is understanding it's your first time doing it, so be easy on yourself. And then protecting your energy. I have one attending, he says, you can only give so many fucks, because you're going to realize there's a lot of problems with the system, and depending on which healthcare system you're working with, there's going to be more problems. So if you keep on thinking you are meant to fix every single problem, you are going to hit a wall pretty quickly and pretty soon. So it's remember to just not give any fucks. And I really reserve what I care for specifically for the patient and make sure I try to do the best by my patient. My consultant doesn't want to be professional, doesn't bother me, just as long as you come and evaluate the patient. If an attending wants to be unprofessional with me, whether it's in RD, and I kind of really, we don't really, luckily, we don't really experience that here in our department, but like other side rotations, I'm like, that's kind of your issue. That's kind of your problem if you're gonna like carry yourself like this. All right, cool. Because I'm gonna leave this hospital and enjoy myself outside of it as well. And again, like she asked the point about enjoying that time with your patients, especially like the non-sick ones, when you can try to like have some witty banter back and forth with them. Just do that and just pick one thing from the day that you really are happy and enjoyed about and focus on that. I mean, really, really do your best to protect your energy. Just, that's the most important thing I took from what you said.
So many gems. Thank y'all so much. I know we're at that hour mark. Typically, we ask our guests if there's anything they want to share in terms of anything on a pub or social media, anything you want the folks out there to know. If there is, feel free. If there isn't, that's okay too. But either way, we're just so thankful that y'all came. Anything y'all want to pub?
Thanks for having us, guys. I don't have anything I want to pub besides Black Lives Matter, and we all know that, but we got to make sure the whole world knows it. So,
Absolutely.
Yeah. Thanks, guys, for putting this on. It's super important to, make time for these kind of conversations and to support each other. So I appreciate you guys doing this.
I appreciate your time. I know someone has to go for a
Thank
shift
you.
soon, so.
Yeah, stay strong.
Appreciate y'all. Thank you.
all right, y'all.
Yay.
Thank y'all, man.
Bye,
Hang in there.
everybody.
All right, see y'all later.